Okay, that's interesting indeed. And have you got data about how protected you are if you only have one shot of the vaccine rather than two?
Well, the recent data suggests one shot may not be enough if you've never had the virus exposure yourself. So, in other words, if you've already been infected and cleared the virus, it's still recommended you get vaccinated. And in that situation, one dose may well be very sufficient for full protection from, say, the AstraZeneca vaccine or the Pfizer vaccine. There's more data to come, and it needs to be more robust before the health advice changes, but that's what the data are pointing to. So that really means it's so important to get your second dose, because for most Australians, they have not had the virus, unlike other parts of the world where obviously many people have unfortunately suffered the virus.
We're seeing reports out of Brazil and indeed the entire continent in South America that this is a particularly deadly strain. Obviously, we have a lot more people travel between India and Australia, so that's why we're concerned about the infection rate there. But can you compare, or has there been research comparing the two strains in India and South America?
Well, we don't know enough about what's going on in India in terms of strains. It's thought to be the UK strain, and there's another strain as well that's circulating that is also a variant. There's also concerns about the double mutant. However, the good news there is it probably doesn't matter in terms of either infectiousness or death rates. Probably the double mutant's no different to the others, and probably the vaccine protection similarly. The South American situation is difficult. You're right, we don't have as many people coming back from there, but it is serious. The P1 variant is of major concern. Again, though, there is evidence, limited evidence, that the mRNA vaccines are protective. Now, we don't have any data on the AstraZeneca that's robust. So I think that's the good news piece of it. But of course, these variants are of concern, and the rampant viral spread will lead to more variants potentially being thrown up, which is why it's so important the world gets vaccinated.
Yes, the world needs to get vaccinated, and our vaccination rate is quite slow here in Australia. Of course, we are essentially free of COVID. But Professor, is there a conversation that needs to be had? Are we eventually going to need to learn how to live with this virus once we do get vaccinated?
Well, I'm actually somewhat optimistic. It's going to be possible we're going to need a booster, or at least depends on the vaccine you get, we may well need a booster. But this may well be also enough to let us go back to our normal lives. So I think that's the really good news. And the booster vaccines, the anti-variant vaccines, if you like, are in development. There's progress there, and I think it looks very, very promising. So a booster may be necessary, and that's the bad news. But the good news is that's a minor inconvenience. It's costly, of course, but a minor inconvenience compared to the virus running rampant. So I think we should look at it that way.